The condition of one's mental health can affect every aspect of that person's life, including how positive and productive that person is in their community. Gandara Center Executive Director Dr. Henry East-Trou is here to talk about how they're helping to treat and prevent mental health right here in Springfield. Thanks for joining me, Doctor. Talk about the services that Gandara Center provides to those here in Springfield suffering from mental health issues.
The Gandara Center is a multi-service agency created in 1977 to actually fill the gaps in services for the Hispanic community. That was the original purpose and mission of the agency. As it grew, the agency began to provide services that involved mental health for children, mental health for adults, outpatient services, day treatment services, residential services, and also an array of prevention services. We've looked at, we've worked with HIV, we work with people who are in the correctional system who are coming out with HIV and they need coordination of care. We work with teen pregnancy prevention, which is a large issue in our community. So we work in an array of ways. We work with people with developmental disorders, with chronic mental illness, with substance abuse, with kids with severe emotional disorder. We work with families, and we try to wrap them. We try to actually provide a full wraparound services for these kids so that they would be able to identify strengths that they have, not only the kids but the families, also the community. We try to involve anyone at all in the community that would actually be part of this team that works with the family.
Now, specifically about mental health,
yes.
What are some of the struggles that somebody goes through when they're facing a mental health problem in their life?
Essentially, people that suffer from mental illness, essentially is really identifying what the mental illness is, issues of identifying who the provider would be, what would be the best way of approaching it. Some people may use, in the Hispanic community, for example, they may use first their priest, they may use sometimes what is called a curandero or a folk healer, and then in conjunction with all of it, they may actually come and seek mental health services.
Okay.
So then they get an assessment, they get assessed by a licensed clinician, psychiatrist, and then the treatment unfolds as after all of that gets done.
Why is this issue so prevalent in this area? Why is Springfield getting hit so hard by this?
It's a good question, and there are many, many factors that affect mental illness, and from poverty to lack of housing, issues of for example, dropout rates with the kids, violence in the community, unemployment, and then you have the other side of it, which is really genetic. So you have, and whether Springfield has a genetic process or anything like that, that doesn't seem likely. What you may have is essentially stressors that impact a situation that may trigger mental illness.
Now, dealing specifically, you had mentioned you deal specifically with the Hispanic community. You guys just had an HIV and AIDS awareness walk. Is this something that you see is impacting the Hispanic community more often than perhaps any other ethnicity?
Because of the community has a high prevalence for the use of needles and using heroin, the issue of sharing needles is a big issue. And also that you have also unprotected sex is the other issue that we have in the community. That continues to happen, and it's happening now in our community more with young people than with older people. Now that HIV is becoming more like a diabetes, a chronic condition, it doesn't mean that it has stopped impacting the community. So people feel more comfortable with it because people are not dying as often as they used to. So that's some of what we need to still provide education. So we aggressively provide education, case management, and work with programs to provide this education within residential programs, outpatient services, outreaching, and so forth.
What message are you trying to get across to the young people, whether they're in the Hispanic community or they're not? What message do you want to reach out to them about?
I think the message that for our youth is essentially the message of opportunity in their future. One of the things that we were striving to do is really to create in Holyoke a resource center for youth this resource center will have an opportunity to provide youth with computer expertise. They would come, get trained, they would get a certificate, a skill level of a certificate, so that they would actually be almost having something to come in to work. Youth in our community are, the Hispanic community probably has the youngest medium age that you can think of, have the largest teen pregnancy prevention, although that's been reduced. So you have very young moms taking care of children. And that's a big issue because that impacts completing school, that impacts taking care of your child, that impacts your future completely. It just changes completely.
Okay, great. And lastly, how does Obamacare, with the new Affordable Health Care Act, how is that going to impact mental health even for all of us?
It's going to really improve the way we do mental health services and indoor substance abuse services in the way that it's going to be more integrative, it's going to be more coordinated, it's going to provide for opportunity to identify people that have very high needs and provide more tailored individual services for them so that they would not be using emergency rooms or they may not be going to the hospital. So you're going to see a lot of wellness and prevention work and a lot of coordination amongst agencies to try to identify what would be the best approach for these individuals.
Great. Well, thank you so much for joining me today.
You're very welcome.